sick and tired of the high costs and inefficiency plaguing our U.S. healthcare system? Do you feel like you're navigating a maze when dealing with insurance companies, only to end up paying a fortune for basic medical services? Then this Broken Healthcare podcast is for you. So get ready to take control of your healthcare. Here's your host, Ray Kober.
And we're live, ladies and gentlemen. Welcome to Broken Healthcare. My name is Ray Kober. I am your host, and I'm joined today by Steven Baek. Nice to have you here with us. Welcome to the big show, Steven.
Thank you for having me. Super excited.
Of course. So tell us a little bit about your journey to where you are today. How did you get involved in the healthcare space? Was it something that you just kind of immediately it resonated with you and boom, that's where you started, or how'd you get here?
I actually first started in my healthcare journey on my second company that I co-founded called Huey Now. It was a remote patient monitoring company that measures, as a wearable device that measures blood pressure, EKG, and heart rate right on your wrist. I started that company because of how arduous and difficult the healthcare journey was, and something that my grandma at that time was going through in terms of monitoring her blood pressure, and EKG required her to, at that age, have to visit hospital all the time. It was very painful. So that's when I started into healthcare journey. And then I faced two challenges in healthcare, just making a product that makes people's life better. One was in clinical trial side. So even if you have a good product, to get it out there, it takes a lot of effort, and a lot of bottlenecks prevent good products from reaching the market. And that's when my second journey into healthcare started, when I joined a company called Vitable. It's a clinical CRO, clinical research management company, and that we help companies get through clinical trials faster and better using technology. But one key factor, despite when you have the good product and then get through clinical trial, one thing that still I saw as a bottleneck was getting access to those technology and solutions. And that's when I met Joe Kitanga, our founder at Vitable. And Vitable's mission was super resonating with me. The fact that you want to give essential healthcare to everyone, especially people who cannot afford the basic healthcare. And that really resonated with me. And here I am helping Vitable grow and get the healthcare to everyone.
All right. So what exactly is Vitable? Because that could have many applications, what you just described. What exactly is it that you do, and what problem do you solve?
Yeah. Our mission is pretty ambitious. We want to put it simply, we want to increase people's lifespan, our members' lifespan, by at least 5 years by giving them easy and affordable access to healthcare. So that's, as you said, can be anything. So where we saw the first problem was, what is the essential healthcare that can really move the needle? And we know that that's primary care. Primary care it's in the word. It's a primary, it's essential. It's where all the healthcare journey starts. And having the ongoing relationship with the primary care provider really makes a difference. And there are tons of studies out there. But in America, more than, I would say, close to one third of the population either are underinsured or uninsured and do not have access to something as simple as when you have a cold, when you have a pink eye, when you have skin irritation, can't even get to go see a doctor. And America is suffering through primary care provider shortage. So Vitable, as a company, we created a membership format for primary care where you can get access to both our primary care physicians and nurses, as well as a bunch of other different point solutions like free prescriptions, labs, and mental health care, all under very affordable monthly subscription that's paid for by your employer. So we are trying to make primary care more accessible to that 1/3 of the population who's having difficulty accessing healthcare.
Oh, and it's so true. If I know that you're in the New York metro area, as am I, and in a traditional healthcare setting, it generally takes me 6+ months to schedule an appointment with a primary care physician, which is insane given what we pay for healthcare in a traditional model. And so it's my contention that the direct primary care model is something that is just, even though it's been around for decades now, it's something that is just, I think, starting to gain some momentum and some traction. And you're definitely fulfilling a huge void there in the marketplace because, folks just can't afford the cost of healthcare, and to, provide them with just the basics, just the essentials, so that if they need care, they have access to it. And you're not talking about, they're not talking to someone in a foreign country necessarily. They're, I would imagine, speaking to, doctors or LPNs or nurse practitioners, registered nurses, that sort of thing. Am I right in stating that, or are these
100%.
folks, board certified, all of that?
Mhm. Our providers are all certified, and they are all locally hired. So
Right.
we have a team of providers that are local to you, especially because Vitable provides that in-person touch by sending our providers directly to our members' home or work site. So instead of having that brick and mortar, which, as you mentioned, creates that bottleneck of having to have limited capacity physically and schedule-wise on how many people you can see.
Mm-hmm.
And that's why when you want to go see a doctor today, and when you ask them about the availability, you usually will find something, if you're lucky, 3 weeks from now, if not 3 months from now,
Right.
because you have that bottleneck of a physical location. Vitable provides our in-person touch by sending our providers to where they live. So our provider will make good old house calls, basically. So they'll walk into your home, see where you live, what the environment is. And that really helps to connect the dots between what's missing that you cannot see about the lifestyle, what you're exposed to as a patient when you're going into the office.
So that's crazy. So you're not necessarily in the same realm as a teledoc, for example, that is providing this service virtually. Your team, and is that exclusively, or do you do hybrid? Do you do both telemedicine and in-person visits? Because talk to me a little bit about the economics of that. If if I put my business cap on and I say, well, they're sending folks out. It's not a Domino's pizza delivery guy that you're sending out. You're sending out an actual MD.
Yeah.
That sounds very cost prohibitive. So how does the model work exactly?
Yeah. And you're definitely right. We are a hybrid model where we do virtual first, and then we provide in-person touch. If you imagine any sort of primary care needs, whether it's just getting your chronic conditions managed, or just getting your flu shots, or trying to have your questions answered about something that's bothering you, most of it can be solved in virtual manner. But the problem between the teledocs and telemedicine in general versus virtual primary care, the big differentiator that a lot of consultants, as well as employers and members, do not see is that teledoc does not provide continuum of care. So whenever you hop on, you will be meeting whoever's next available. They do not have your history. They do not know you by name. They don't know what you talked about last time. But when you have a primary PCP, a primary care provider, you know that they understand all the details from 2-3 years ago, why this is happening to you. And building that relationship makes a huge difference. So our virtual, despite being same telemedicine, virtual, is provided by the same provider versus random person who's just next available. So that's a huge difference. But in terms of unit economics, we see about 10 to 15% of our visits being done in person. Many of them can be done virtually, but when you do need that extra step of in-person touch, you need a solution for that. And that's where Vitable's in-person operation, whether it's on-site by visiting the office or whether it's in-home, or sending you to a nearby clinic. I think those are all valuable options, and Vitable tries to make sure we don't leave any gaps in between
Mm.
care.
So give me an example, Stephen, of when you would, one of those 10% examples of when it would, necessitate an in-home visit.
Yeah. Um, Anything that requires someone to do something physically is a good example. Um, let's see. So annual checkup, like annual wellness visit, you cannot do that virtually because someone will need to check your blood pressure, or maybe you need some lab work to draw blood.
Mm-hmm.
Then that's when our provider will visit your home. When you need to see something and manage something that is physical, that you need to see for yourself or provide in person, that's when that 10% happens. But if you could imagine not the worst case, but base cases of all the healthcare needs, that's why 80 to 90% of them do not fall into that healthcare need. Whether I have a pink eye, I have a cough, it would be great if you can get a stethoscope and listen to your chest. But most of those, even if you do go to the hospital or to primary care's office, it will be a very brief moment of that, but rest of it will be just talking, conversing. And
Yep.
those are the ones where you can do virtually, and ones where nurses have to come in and get your blood drawn, blood pressure checked, weight measured, those kind of things, or see your eyes or legs in person. That's when we need the in-person visits.
Got it. How much is technology factoring in? Because as you're talking,
Yeah.
my mind is going and I'm thinking, well, we've come so far with tech now and wearables and devices, and I guess one of the risks, if I'm playing devil's advocate, of not being seen is, I don't know, maybe I'm complaining of ear pain and I suspect I have an ear infection, but I'm not sure. And the only way to really verify it is for a physician to scope my ear. So that I would imagine might be an example of an in-person visit. But my curiosity though is, are we getting to a place now where technology, or maybe it's not here yet, but you see it on the horizon, where in maybe a company like yours will pioneer it, or maybe you'll partner with other businesses, but where they'll have devices that you can kind of clip onto your ear, or open your mouth and stick your tongue out and it'll take a picture. I would imagine a lot of this stuff is very doable. It's just a matter of having the hardware to do it.
100%. And if I put my hat back on, as I said, with the remote patient monitoring background that I have,
Yep.
With the technology that we have, a lot of that will be solvable. And we can make it cheap enough that it's easily distributable to people, that they can measure with a little camera that that can serve multiple purpose. You can put it in your ear, your throat, nose to show all all different sides directly virtually to remove the barrier of doctor having to see it in person. Same with my previous company, Hewitt, where you can measure EKG and blood pressure. You don't have to have that person. It's a remote monitoring machine that can measure all those by yourself. The problem with that, the technology is there. And if enough demand is there, and if the insurance companies can, I guess, get to the point of actually wanting to get that involved and pay for those devices, we will be able to get that distributed. But the problem is you cannot trust the patient to administer it in the correct way.
Mm-hmm.
I think that's where the bottleneck still exists. And
Right.
even if it's the same as simple of a camera, how far are you shoving it in your nose? Where are you measuring your blood pressure?
Right.
Are you doing it over your clothes? Are you doing it while standing up? All those make a difference. And that detailed nuance and instruction gets lost in virtual. I think once we figure that part out, I think we can really go through that hurdle and get to the next stage of really providing more accessible care.
Yeah, interesting. So, and I guess there are two issues that kind of scream out at me, and first and foremost, it's the health and well-being of the patient. Want to make sure that if we're giving them these controls, that they're doing their part and measuring accurately. That's a huge one to overcome. And then the other thing that I guess you'd have to think about is also liability. And God forbid if they do administer a test wrong and something goes awry,
Yeah.
does that lead to complications that lead to lawsuits? And nobody wants that, right? So,
Yeah.
so interesting. So, getting back to the economics, what does it cost to have? I'm talking about hard dollar costs. If we're on Shark Tank and I'm Mr. Wonderful and I say, well, tell me a little bit about your model and what does it cost you to send a doctor out there?
Yeah. A lot of our providers are mix of, we have MDs that are full-time W-2s, and then we have a lot of nurse practitioners and different types of nurses that are 1099. And we have their availability in advance, and that's where technology comes in. We often compare it to Uber or Uber Eats model, where by having their availability as well as where our patients and members are located, we can use our algorithm to best route, most time efficient manner, and distance wise as well, to minimize the travel time. So our goal with using technology is to how can we efficiently utilize our providers' time, and we also include technologies like that makes charting and EHR simpler. So our providers, unlike typical at hospital, are not spending 70-80% of their time writing down the charts. So they can spend more time with patients. And unit economics wise, our providers are paid the hourly rate. It really depends on the provider, but let's say it's somewhere between $60 to $100 per hour. And if it's virtual, our average visit times are much higher than typical primary care provider visits. I think typical primary care provider visits are under 10 minutes, typically. We usually have 20 to 25-minute visits. So at maximum, we could have 3 visits per hour. Often we have 2.5 visits per hour. And you can imagine that costs about $30 for us. And Vitable, with our cost, if we can imagine, if you utilize Vitable every single month, we will break even with that cost versus what is acquiring us to utilize the service. So we are confident even when we achieve our ultimate goal of making the accessibility there and everyone is utilizing Vitable as intended, we'll be still staying afloat and positive versus a lot of businesses out there, a lot of our competitors would usually try to drive as little of engagement as possible. I think that is a really huge difference. Our unit economics are efficient enough that even at the full capacity, we still break even and make money.
Awesome. And so how long have you guys been around?
We've been around since 2019. We started our service in 2020, right as COVID started.
That's an ideal time, I would think, to start up a virtual business, right? Or a hybrid business in your case. And so in terms of the in-person visits, I'm guessing that that's not necessarily by the primary care physician, but they're going out there and they have the expertise to, do an exam, report back to the primary, and then the primary care team is the same team, and they have the ability to review the records and continuity of service and all that stuff. Yeah,
exactly. When you hop on Vitable, we show you your care team. That includes everything from the physician as well as your nurse practitioners and MAs and RNs. That each person gets their dedicated team that you can select, and that team is the one who's administering your primary care, not just to you, but your entire household. And I think that is also really important differentiator. When you sign up for Vitable as an employee, when your employer gets Vitable to their employees as a benefit, you can actually disseminate that benefit to your entire household and dependents for free. There's no additional charge to add as many dependents as you want. So we have some members, employees who have over 10 dependents in one account. Same price as if you're just using it by yourself. So our team of provider really makes sense when you have multiple people using the account, because you now have access to multiple different types of providers.
Gotcha. And so, in your model, how does it? Is there such a thing as typical in terms of the way that a plan is set up? And what I mean by that is, would an employer that is fully insured with a primary, with a traditional network, et cetera, benefit? And do you have clients that are fully insured that use your service as a bolt-on? Is it more likely that they'd be in a self-funded arrangement where there's customization? Is it a one-size-fits-all, or how does it break down in your current book of business?
Yeah. I don't want to say it's one size fits all, but it is. That's the reality.
Yeah.
And to give you a little bit of context, Vitable, when we first started in 2020, didn't really know fully insured, self-funded. We didn't really care about that as much. We wanted to just provide access to primary care. And we were selling often to small businesses directly. We didn't go through brokers. We didn't really, and we were specifically targeting employers that did not have any benefits in place, and at least providing Vitable as their first line of defense. But because we built our program to be so affordable and so accessible, that drives high utilization and a fixed monthly cost, we saw, without intending, how effective it could be in an actual fully insured or self-funded plans. If you could imagine, if you have a monthly membership that can redirect a lot of the claims that otherwise would hit your plan design, that's what Vitable is. So whether it's a mental health visit or prescriptions or chronic care management, we take up enough of claims and redirect it and park it in the very low cost monthly fixed PPM that we were able to get attested by Windsor Strategy Partners, which is a big actuarial firm that has reviewed all of our claims data with the self-funded groups to show, hey, Vitable can have enough utilization that in any scenario of any type of plan design, in average, could reduce your claims by at least 10%. And they recommended stop loss companies to provide discounts under stop loss. So that's how we entered into self-funded side of the business. And then we also saw, if you put simply, if you put Vitable in your renewal, let's say you're a self-funded group and you have like 100, 200 employees and you have, let's say, stop loss aggregate of about $1 million. And that $1 million, when you renew with Vitable attached next year, will drop by 10 to 12%. So you're actually automatically saving $100,000, $120,000 on your average. And then you start to remove claims from there on. So the ROI is huge. So in terms of our overall book of business, we do have about, right now, we just started that journey in the self-funded side last year. So we have about 20% there. And then we do have a huge book of business with a lot of fully insured groups, I would say about 40%. And then we also do really well with minimum essential coverage, ACA compliance plans. Because minimum essential coverage covers so little, and it's intended to cover so little, just to provide that ACA compliance, it fits perfectly to add Vitable. That ensures that your employees will at least get the essential primary care as well as mental health and prescription, while you as an employer get the ACA compliance. So that's the three, I guess, different scenarios Vitable plays really well with.
This episode of Broken Healthcare Podcast is brought to you by Benefixa Healthcare Consultants. Visit benefixa.com to learn what's possible. Reduce the cost of healthcare for your organization, deliver better outcomes for your people, and yes, design health plans that give your people a path to $0 out-of-pocket costs for healthcare. Visit benefixa.com today. Interesting. Yeah. So the name of the game, folks, for those that are not aware, is claims. If you can reduce the cost of claims, you are effectively reducing the cost of healthcare. And there's an actuarial science that applies to insurance in the same way that it applies to many things. And the way that it breaks down is 80% of your overall insurance costs are claims costs. That's the biggest piece of the pie by far. And so what Steven is suggesting is, hey, fully insured, self-funded, either way. So in the case of a fully insured plan, if now you're plugging in Vitable, all of the claims associated with going to a primary care physician could essentially be covered by their service. And in doing so, don't factor into your plan's claims bucket. And so when that happens, you're lowering your overall claims. And when it comes time to renew for large groups in states like New York, it's 100 plus lives that are experience rated. The insurance carrier, the Uniteds, the Aetnas of the world are looking at your particular group, saying, "All right, how did it perform? They paid us $1 million. Did we pay out 500,000 in claims, in which the case was a big winner, or did we pay out $2 million in claims, in which the case this group was a big loser?" And your renewal is going to depend on your claims costs. And so with a service like Vitable, you're certainly going to reduce claims, and depending upon your group, and who your employees are and who your members are, if you're a group that's running hot, it certainly might make sense to plug in a service like this, because again, math is math, and you're gonna be reducing your claims costs. Now, to be fair, these claims that we're talking about are not necessarily the high ticket smoking gun claims costs, right? So that comes with major prescription drugs. It comes with hospitalizations, surgeries, unnecessary surgeries. Those are conversations for a different day. But certainly, if you have a group, a team that is, they're seeing their doctors on the regular. Maybe they're managing, comorbidities. A group or a service like Vitable might certainly work well. And of course, if we're talking about the self-funded world, well, then the whole idea and concept of going self-funded, even though it's a payment mechanism, is to manage claims. And so if you have a mechanism whereby you can wrap your head around that, and I would imagine one of the benefits, and you correct me if I'm wrong, Stephen, but I would imagine that any of the data that your team collects is something that you share back with the self-funded employer, so that they then have a tool and a mechanism to have better insight as to what's going on with their group, so that they can make adjustments and best address costs.
100%. And I think that is one thing that I find in the primary care industry, especially direct primary care, that is missing, that we are trying to solve. Transparency and accessibility to data. So a lot of providers that are jumping into direct primary care are doing so because they're fed up with the insurance system, having to file paperwork and report to someone that they don't work for. But that behavior also comes with the fact that they have difficult time sharing that data transparently with all their employer groups. And they don't play well with the team. And Vitable, having a centralized hub of our headquarters with all of our providers working under our team with a very specific guideline of how we provide care, not only provide consistency, but we do provide a real-time, transparent utilization data. So it actually, if you have our dashboard access, you'll be able to see your group's visits, prescriptions, what type of reasons, and how much cost saving there would have been otherwise if you didn't have Vitable, are all visible in real time.
Oh, that's huge.
Yeah. And I actually wanted to double click on what you were mentioning about claims, especially on the fully insured side too. And I think you hit it like nail on the head right there. Primary care is meant to really take care of those small claims, the everyday claims. But what we have been seeing for groups that are renewing with their third, fourth, fifth year now is you actually will remove people who are care deferrers. That's what we call them. They usually don't go to doctors because it's so difficult. You don't have time. So whether it's something as simple as diabetes or blood pressure, all the way to something that's bothering you in your skin, you can actually, in the longer term period, where it's starting to become more confident with our data, that it starts from those aggregate small claims. But as you have better access to primary care, that's right at the same day, next day level, not 3 months down the line, you actually could significantly impact your spec claims as well as you do that. Because you are preventing those high ticket items from happening, high prescriptions from happening. And it really makes a huge difference for renewal dollar amounts for the groups that are using Vitable consistently over the years. So I think that is something that we hope to do a longer term study to really wake up the industry on how this could really impact overall healthcare cost.
Awesome. You're doing great work, Steven. Really appreciate you and what you're doing, because we need solutions for folks that, just don't have them right now. And it sounds to me like you're solving a very important problem. Is there a minimum group size, and give us an idea what this costs?
The cost is about $1 per day per employee. I think that's a good way to think about it. We sell it at $30 as a starting base model. We priced it in that way because we want the employers to make it as affordable as possible. But it's even more affordable if you think about per member per month wise, because when we actually quote, we don't call it PEPM, we quote it PHPM, per household per month, because you get the dependents for free. You don't have to pay extra for spouses and children.
Right.
So when it comes to per member, we usually see, instead of $30 per month, we see per member about $8 in the price point. So it's actually very affordable when you think about how much access you're getting, including mental health and prescription and things like that. So that is the price point. And we go as low as 20, 10 size group, all the way to, we have 10,000,
wow,
like cities and things like that. So I think we have very flexible program, and primary care should be accessible to bigger groups and small groups.
Yeah, that sounds great. How do folks find you?
I think the best way to reach out to us is through our website, vitablehealth.com. There's a very easy way to reach out to us through there.
And Vitable is Vitable, Vitable?
Yep, vitablehealth.com.
Vitablehealth.com. All right, that's easy enough.
Yeah, that's easy enough.
Cool. All right. Well, hey, listen, you've been great. I really appreciate you coming on. I love the journey. I think, you at your price point, $30 per household per month. That's hard to argue with. $360 a year, according to my math. Is that right?
Yep,
Right.
per employee. Yep,
per employee. Yeah, there we go. Math still works. If you think about it, that's not even a bonus for an employee, or you could certainly think of it as a bonus for an employee. But I'm thinking about the ticket cost, and that's nothing. For a very valuable service that also will pay dividends to an employer in lower claims. So, hey, you're on a mission. I really appreciate you. Keep on keeping on. And folks, until next time, peace and love, peace and love. Take care.
So that's it for today's episode of Broken Healthcare. Head on over to iTunes or wherever you listen and subscribe to the show. And join us on the next episode.